How do you go from a hero to a zero overnight? It's ridiculous.
As the region braces for a post-Thanksgiving spike in coronavirus cases, the nurses inside Montefiore New Rochelle Hospital.
We were transferring patients out like crazy yesterday. It was unbelievable.
Patients turned away as 200 union nurses walked out of labor rooms and ICUs and onto the picket line.
The heart of the strike is patient care.
This two-day strike over unfair labor practices began at 7 this morning. Monday, negotiations broke down between the New York State Nurses Association and Montefiore New Rochelle. The hospital says they've offered over 7% in wage increases, funding for their pensions, and health insurance with no employee contributions. But for these nurses, there is one unmet demand that is urgent.
We don't have adequate staffing to take care of the patients.
Nurses tell Pix 11 they work with an average of 10 patients on a medical floor. The union believes that number should be slashed to just 6 patients per nurse.
During the first COVID wave, it was a disaster in there.
Maria Castillo was in the heart of that disaster. She's a nurse in the emergency room.
So many of us got sick. So many of us were out of work for way over 10 days. Some of us even died.
8 months later,
We're even more short-staffed now than we were back in April.
these healthcare professionals say they will keep pushing back until staffing levels are brought up. Tamsin and Corey, coming up at 6, you're going to see the moment when a mom who was just leaving the hospital after giving birth stopped to say thank you to these nurses on the picket line and express her support. For now, reporting live from New Rochelle, Ayana Harry, Pix 11 News.